right, well, I think we'll go ahead and get started. I'm very happy to introduce Dr. Cindy Liu, who's an assistant professor of pediatrics at Harvard Medical School. She's also the director of the Developmental Risk and Cultural Resilience Laboratory at Brigham and Women's Hospital. Her research focuses on culture, socio-emotional development, and race and ethnic disparities as they are related to maternal and child mental health. She's received numerous grant awards from NIH, the American Psychological Association, Robert Wood Johnson, among others. She's also a licensed clinical psychologist, serves on the American Psychological Association, very timely effort on stress and health disparities working group, and is also on the Massachusetts Department of Mental Health Multicultural Advisory Committee. And she does incredibly interesting and wonderful work. And I can say, as I have been collaborating with Dr. Liu recently, that it is a joy to collaborate. Really thoughtful team, doing some really fascinating work on young adults and understanding mental health and factors that influence mental health, both negative and positive. So we're really happy to have her here. She's going to present the developmental talk today on developmental and generational perspectives to understanding COVID-19, young adult mental health. And just to say, this is part of our 2021-2022 seminar series organized on the theme of recovery and resilience, which, as we know, is we're still in need of. So we're happy to welcome Dr. Liu today. I'll just say that for folks who have questions, you can put them in the chat, and I will moderate the questions. So we'll have some time for Q&A at the end of the talk. And if anyone needs to leave early, we are also recording the talk, so it'll be available if you're interested as well. So with that, I'll hand it over to you. Thanks, Cindy.
Thank you so much for that lovely introduction and just for the opportunity to speak with you all today. It's a small group, and I'm here for selfish reasons, which is that I do hope that there'll be plenty of time for Q&A for me to hear people's thoughts about our data, but also any kind of reflections that you might have about the pandemic, which I will be speaking about today. So with that, I'm going to start with, advancing my slides. I'm going to start with just a recap of what we know about mental health among young adults in pre-pandemic times, if you can recall back to that period. We had done some work looking at mental health and suicide among college students. This was around 2018, 2019. And no surprise to many of you, but the rates of mental health and suicidality are just so high. They were so high. And we found that in our data set of about 70,000 undergraduate, that 1 out of 5 students had reported contemplating suicide sometime in their life at the time in which they completed this survey. We saw various subgroups that were more vulnerable to mental health concerns. Bisexual students were more likely to report mental health diagnoses and suicidality. Transgender students report a much higher rate as well. And we also saw that racial and ethnic minority students were less likely to report mental health diagnoses relative to whites. However, their report of suicidality was mixed. So we actually saw high rates of suicidality despite racial minority students having fewer diagnoses.
Cindy, can I just jump in? Are you trying to share your screen? Because we're not seeing any slides.
Oh my goodness, did I not go ahead and do that? That would be a good thing to do, huh? Okay, let me go ahead and do that. You see it? Okay, all right.
That's better. So you're not in slide view, but we do see slides.
Yeah, and I will go into slide view right now.
Okay.
All right. So now you can see my title page. I have a title page, everyone. Hooray. And all right. So thank you for mentioning that. And so this was a paper that we had written. It was published in, I think, 2019. And this was the data that I was referring to, right? So again, high rates of mental health diagnoses and suicide. This was before the pandemic. No surprise to many of you, but just to underscore that, quite honestly, mental health was a big issue and continues to be a big issue. When we look at if we look at groups by race, we also see these differences, but in general, 1 out of 10 students reported contemplating suicide just in the past 12 months. And so with that, what is so unique about college age youth and young adulthood? So, these pictures depict various facets of college and young adult life. It's a time in which young adults pursue independence. They move out of their homes. They move into dorm rooms and live with other young adults. They're separating from their home life and creating a different context. They're establishing new relationships, including romantic relationships. And this is all in addition to their academic work. And when we think about their academic work and why they're in school and their hopes and dreams for what they're doing, we often think in a very linear fashion, which is you find what you're interested in and you pursue that, you take the courses and you get a job. But the reality is that it is nonlinear. It is extremely messy. There's a lot of twists and turns, a lot of surprises. I can, many of you can probably attest to your own journey with your career that things happen out of the blue and that these paths are all quite unique. And they come out of nowhere and they can be very stressful, right? And so one of the things that we think about, or at least I think about when I study mental health in young adults and college students, is just the various sources of stress and how that is associated with their mental health. But at the same time, I do think that in this current place, we are much more likely to talk about mental health more openly, with just more awareness related to mental health and combating stigma. And there have been efforts, including where I trained at McLean Hospital, they had a whole campaign on deconstructing stigma and just helping people to really change their attitudes about disclosures related to mental health. And what we see is that this may actually be related to the increased rates in mental health service utilization. And so my colleague, Sarah Lipson over at BU published this work finding actually an increased rate of mental health service utilization over a 10-year period. And so, she attributes this to indeed sort of this true mental health experience increase, but at the same time that it may be due to just greater awareness that people are reporting these mental health concerns, thus driving these rates up. So what about now, right? We're in a pandemic. We know so much more about the pandemic than before, and we recognize, I would say, that it has taken a toll on people's mental health. If you were just to sort of recap, back in almost 2 years ago, there was a period in which it had pandemic potential, but it was not here. So this may have been a familiar scene to some of you. And as well, our lifestyles and daily routines were altered as a result of just the disruption due to the pandemic. And for college students, they're an interesting population because they were perhaps the first group that were asked to physically leave their homes. And we know so much about displacement in various other populations and in history and how stressful that is. I'm going to come back to that. But the fact that students were moving was something that was really apparent to us, especially here in Boston. And we also had students in our lab who were wondering where they were going to go if their school was going to ask them to leave. And so at that point, we wrote quite quickly some of our thinking about the priorities for students. And we highlighted that there were going to be a couple of subpopulations that we felt were going to be disadvantaged as a result of just the campus relocation and the remote learning and so forth. And I know I'm preaching to the crowd because there are students and also professors here who know firsthand what what this was all about. But I'll say that back then, there was actually not a lot being talked about with respect to mental health, right? A lot of the focus, a lot of the energy, a lot of the resources pertain to mitigating the transmission of the virus. And that makes so much sense. But at the same time, if you're a psychologist or anyone in mental health, you know that the shutdown of a society is going to have such a wide scale impact on mental health. So it was actually a while before people quite recognized and the need for being able to channel resources and to be able to collect data on this, to understand how to actually address it. If you look at the census household pulse data to understand more about mental health, they have this really great website, which I check often to see the current experiences in the US. And what you find from that data is, here I have April to December 2020, is that there were there's an increase in the rates of depression symptoms based on their screener. And if you stratify by race, there's a major difference. So the red on the figure below represents young people between the ages of 18 to 29. And you actually see that that's higher than all the other age groups. And there's also blips and sort of major increases in these rates. They hover around about 40% and sometimes 50%. And if you see towards the right, I have designated that period in which we had the US presidential election, and there was actually an increase there in the depression symptoms. And you also see that, especially perhaps more apparently in the anxiety symptoms, that there is actually quite a blip over there. And I'm going to come back to what that might actually mean. But this is all to say that young people are suffering more as it pertains to mental health. So we sought to understand this a bit more, the unique challenges that young adults might be having during the pandemic. So despite the fact that their physical health was relatively, better, they fared better as a result of the pandemic, we wanted to know about their mental health. So we were able to get rapid funding from the National Science Foundation and started collecting data in April of 2020, so just 1 month after the US designated the pandemic as a pandemic. To date, we have about 1,400 young adults who participated in our first wave of data. I'll say a little bit more later, but we are currently about to launch our fourth wave of data. And this is just to give you a sense of the sample. Most are are college students, and then we'll have about the majority white. The second largest group is Asian, and then the rest comprise of various other racial groups. And one of the important things that we wanted to do was to try and measure COVID-related experiences, right? We've never had a pandemic, so what are the experiences that may be more salient to mental health? We, put together a couple of measures. One was COVID-19 related worry, and we captured the things that people were worried about at that time. We also looked into the literature and applied a complicated grief measure and added a few items of our own to be able to capture what people were also sharing, which is that they were missing out on routines, and that itself made people feel resentful or even stunned and dazed. What we see here, and this is just based on our measures that we had created, that there were the large majority of our young adults experienced what we considered high levels of grief and high levels of COVID-related worry. And this is just to give you a glimpse of the types of things that people were worried about. They were worried about the health and safety of family members. There was also stress on romantic relationships. In fact, this one individual said that they were supposed to get married and they actually called off the wedding. We also assessed loneliness using the 3-item scale and saw that about 2/3 reported high levels of loneliness. And we also got some really interesting responses related to isolation. We assessed social support, and what I can say is that the large majority of individuals felt like they had high levels of social support. But what I'd like to orient you is the fact that even though the majority indicated high, that about 1/3 of our young adults reported having low family social support. And so this, again, is a glimpse of some of the responses that we had in our free response. And I'm not going to go through all of it because I do want to get to some of the latest work, but this is just a glimpse of what we were able to obtain. What we see is that there were a number of different factors associated with depressive anxiety and PTSD symptoms. And interestingly, family social support made a difference, or at least was associated with these mental health outcomes, but not partner or peer support. And one interpretation that we had was that for young adults, many of them went back home. And so their family social support may have mattered more. And also when your friends, your peers are going through something similar to you, it may be actually harder to be able to obtain social support from them because everyone's going through the same thing. They're all sort of trying to figure out and figure out how to manage that current situation. So what about young adults with pre-existing mental health concerns? And here I'm going to talk about various subgroups in our sample. What we see, not surprisingly, is that for those who suspected having a mental health diagnosis or were diagnosed, either treated or non-treated, that they were more likely to have higher levels of mental health symptoms. So not a big surprise. And in fact, the likelihood of that ranged between around 3 to 6 in terms of the odds for being more likely to have a score in the probable range for mental health. They too also showed poor sleep problems. Overall ratings of physical and mental health were higher among these groups that were either had suspected or diagnoses of prior mental health. And they were also more worried and they experienced more grief as a result of the pandemic. And so these are some of the responses that we got where people talked about the worsening of their mental health. And in fact, one person indicated that the first panic attack they had was during the quarantine. So another subgroup, as I mentioned before, includes college students. And because they were the first to move, we were really interested about how things would fare for them. We heard stories, I'm sure you all have heard stories about college students and the disruption of having to move. We had students who talked about going on spring break or going abroad and not being able to come back and get their things and move. So this seemed like a relatively common phenomenon. And knowing what we know about relocation in both humans and in animal research, that is a major, major life stress. We wondered what this would be like for students at that time. So we went ahead, and even though this was a cross-sectional study, we just wanted to look and get a better sense of whether or not students who had to relocate versus had worse mental health compared to those who actually did not have to relocate from their campuses. And this is what we found. We found that campus relocation was associated with higher levels of COVID-19 related grief. It was also associated with loneliness. And it was also associated with higher levels of generalized anxiety symptoms. We also asked, well, if students may have had greater symptoms if they had to move versus those who did not, what about whether or not you had to leave your things behind? Did that actually matter? So we looked among those students who had to move, whether or not they had to leave some personal belongings behind. And again, some people couldn't get back to their things, and we also saw responses of students who said they couldn't get their glasses, they couldn't get their CPAP machines and other medications. So we wondered if that made a difference. And the answer is maybe, yes. We did see associations between leaving your valuable belongings behind. So if you did, you were more likely to report greater COVID-19 related worry, greater COVID-19 related grief, as well as these other mental health symptoms. And we also controlled for whether, when they did the survey, we also controlled for COVID-19 transmission at the time of the relocation. So based on their location, we checked to see, was it due to the fact that where they were located had a major outbreak, and therefore it might be affected with their mental health. We controlled for all those different characteristics, and still the relocation variable seemed to emerge as a potential unique predictor. And so what we concluded was that maybe, though despite that this design was cross-sectional, that there might be lasting effects on the psychological functioning of students due to campus relocation, and that the loss of valuable or tangible objects may lead to this greater sense of vulnerability for students. As I mentioned, we actually have longitudinal data, and we're planning to look and see whether or not these lasting effects truly have lasted over the course of the year and a half. So I had mentioned or alluded to various US events that seem to coincide with the population representative data that I had showed earlier. And so we wanted to do a deeper dive into that, knowing that we had the study that took place during major societal upheaval, knowing from the responses from young adults that the social climate seemed to be very much on the forefront of their minds. We wanted to know whether or not it affected well-being among the young adults. So this is some data that we submitted. We are now, I'm actually revising that. I've been working on that the past few days. And we wanted to look to see for all the, for the major stressors that have taken place during the pandemic, thinking about loneliness, worrying about getting COVID, financial stress that might pertain to young adults, and also the social climate. Do these predict increased mental health symptoms, specifically depression or anxiety at the second time point? And we actually got the second time point in the fall of 2020. And so as you can see below, we see that loneliness was associated with depression. Financial stress was also associated with depression at that second time point. Interestingly, COVID-related risk and social climate were associated with anxiety. And in fact, for individuals who reported being concerned about the social climate, they were about 54% more likely to endorse greater anxiety at T2. And so beyond the social climate, we also considered, other types of concerns as well. For instance, discrimination. And so I have a particular interest in Asian American mental health, and had been sort of noticing and observing and tracking the discussion about increased discrimination from the very beginning of the pandemic. And we were able to measure that in our data. So what we looked at was in our first time point, their report of discrimination, both lifetime as well as COVID-related discrimination targeting Asians. And we happen to have a lot of Asians in our data. And as you can see on the right, these were some of the questions that we had asked as it pertained to specific Asian related discrimination. And we find that after controlling for lifetime discrimination, that perceived COVID-19 related discrimination was associated with greater levels of PTSD. And so this was just for the first time point, but as we can see here, there might be something there in terms of discrimination and PTSD symptoms, which really represent, together sort of greater vigilance, not just general stress, but also greater vigilance around involving their surroundings. And it makes conceptual sense, right? So if you are, exposed to personally, or if you see family members who have faced discrimination, you may be more vigilant in your day-to-day activities. We have a postdoc now who's doing a deeper dive into the experiences of discrimination. In our third time point, which took place right after the Atlanta shootings, in which about a number of Asian American women were killed, we actually asked more about the experiences of the Asian Americans in our sample, and specifically inquired about vicarious discrimination experiences. And what we find is that there was, pretty prevalent exposure to vicarious discrimination. As you can see here, that the news and the social media and online portrayals of discrimination was something that individuals were exposed to at least once a week. And I'm sure many of you, if you read the news, are familiar with this. But we also, have been looking to see whether or not these forms of vicarious discrimination was associated with racial trauma that we were also able to obtain in that time point. And this is new data that we just analyzed, again, not yet published, but we're currently writing it up. And what we're seeing is that vicarious discrimination in our Asian American sample is associated with higher levels of racial trauma that mimic the previous findings that I just presented. A question, especially with the theme of this seminar is resilience, recovery and resilience, is whether or not there have been any silver linings to the experiences of young adults. And it was a question that we asked in our data in the second time point. And granted, that was really just not even a year out from the pandemic, but we wondered about it. It's kind of funny to think now because we're like in month, I don't know, almost 2 years of the pandemic. But back then we wanted to see if there was any kind of impression about how people might be doing, okay, or if they've found silver linings. And what we found was that young adults really did not experience any kind of post-traumatic growth. It was quite low. Their scores were quite low. So in general, they responded with they didn't experience any changes, or if they were to experience a change, it was to a small degree. Some follow-up analyses to this are displayed here, and what we wondered about was whether or not post-traumatic growth might moderate the associations between pandemic-related distress and depression symptoms at the third time point. What we find here is that there is a moderation effect. If for individuals who reported experiencing a lot of distress as it relates to the pandemic, that if they reported having high levels of post-traumatic growth, that actually buffered and protected them from depressive symptoms. So you can see that with the sort of like the bolder dotted line on the bottom here. So there may be something to the post-traumatic growth. I have to say I'm not a post-traumatic growth researcher. This was something that we put in there because we were simply just curious about the experiences of young adults. And we had seen in some of the responses some silver linings, and we wanted to explore that a bit more through our quantitative measures. So what I can say is that there are some major takeaways as we have been just going through the data. When we step back, we can conclude that the mental health continues to be a public health crisis for young adults. The rates are just so high. And granted, our data is not a population, a representative sample, but our data does seem to parallel the data that we see in the representative samples. Very high rates of depression, anxiety, and PTSD. There's not a lot of students or young adults who are saying that they are resilient. About a quarter say they are able to handle distress. So what we're seeing is that they are struggling to cope. And as you can see in this infographic, some of the quotes that really support that include, "I'm devastated by the reality of the world right now. I can't escape the negativity." And so all of this is to say that we do need to invest more in the mental health of young adults, especially when we think about this generation as the generation that's going to comprise of the majority of the workforce in about 10 years. We really do need to think more carefully about this population. The other thing that I do want to mention is that the social climate may be an important contributor to mental health concerns. And the data suggests that this may matter a great deal, more so than when we think about the pandemic as it has brought upon social isolation and financial stress. We don't want to miss on some of the other potential risk factors for young adults, and that includes their concern about the social climate. If you look at the infographics on the right, what you do see is that there have been a number of topics that have come up in our qualitative analysis, as well in the far right panel, you do see too that despite the concern and perhaps feeling disheartened by society, that there seems to be really good involvement in social activism among young adults. And I was actually really surprised to see these rates. We have about 80% of our young adults having signed an email or a petition, but then moreover, the majority of our young adults have contacted public officials, participated in civil rights groups, joined a protest. These are all things that suggest that they're civically engaged, and that despite the potential sort of feelings of hopelessness, that they are still engaged and feel as if that perhaps this is a moment in which their actions can affect change. Another takeaway that I do want to highlight is that we must consider the experiences of various groups. And I've also, I've mentioned a number of groups so far. We've looked at those with pre-existing mental health concerns. We've looked at Asian Americans. And I also wanted to highlight a paper that a couple of our med students were involved in. They sought to increase our sample of sexual gender minority young adults, and in turn, we're able to look more closely at that data to understand their experiences. And actually, they're looking to do a follow-up with our data now that we have a couple of additional time points. But this is to say that we must consider the experiences of these subgroups. There was actually a working group, I believe from the Lancet, that produced a report indicating that the increase in psychiatric distress across various studies around the world show that there was an increase, but that it came back to baseline about 3 or 4 months after the onset of the outbreak within each country. And so they had concluded that in general, the populations were pretty resilient. And while that may be the case, it does potentially dismiss the experiences of these various groups, which already, I would argue, are those which have been disadvantaged even before the pandemic. This is a meme, and it represents, I would say, my work and what my colleagues are, how we're thinking about our data. And, part of it is understanding the experiences of so many, but also selfishly wanting to know more about what really happened during that period of time, but also to think about whether or not that can be predictive of what we need to do now. So more to come when it comes to 2020. Hopefully we can be able to think more strategically about ways to channel our resources in order to mitigate any kind of consequences from the early days of the pandemic. Additional thoughts and directions. I'm so pleased to be able to work with Dr. Kobzanski on thinking about how to really hone in on the experiences of young adults, knowing what we know already, and in expanding our thinking about when they say they're worried for the world, what does that actually mean? Can we actually measure that? Are there specific associations with that concern with any kind of mental health or physical health outcomes? And so we're trying to construct what that actually means, a sense of safety, and we hope to be able to do that in our 4th time point, which will get launched in the next month or so. And then also going back to stigma, is there a way now, since people are able to recognize that mental health is an issue, that it's prevalent, and that perhaps people may be less dismissive of it, can we actually leverage that opinion and use that to try to address stigma? For so long, we've been trying to do that with little success. Could this be the time? So with that, I just wanted to acknowledge all the people that have been involved in this work. We've been so fortunate to have so many trainees interested in collecting and analyzing the data with us. And I've been so fortunate to just get people's opinions, because I think that personal experiences and just insights have been helpful in helping us think about the next set of directions for this work. So I just wanted to acknowledge these individuals as well as our funding sources, both federal and philanthropy. So that is it, my end. If you want more information, here's my contact as well as our website for our CARES study.
Well, thank you. That's great. And we have a nice amount of time for conversation and discussion. So I'm going to invite people to put any questions they have into the chat. And while people are gathering their thoughts, I have a couple of questions that I'll start with. So I wonder if you talked about kind of silver linings, and a few people seem to be experiencing post-traumatic growth. And I was just wondering if you have any sense of what factors, who are the people who are experiencing post-traumatic growth? Are they experiencing different circumstances than other folks? Are they the ones who are more socially engaged? So I don't know if you guys have had a chance to look at why and who is more likely to be resilient or be able to take something from these experiences.
Yeah, well, I'll have to say first that I think we put in that measure too early. And that's due in part to my inexperience in my sort of lack of knowledge about this construct. But I think in general, there's not a lot that is known about it. If I can recall the paper in which we actually looked at this, and we kind of looked at basic social demographics and its associations with PTGI. The one thing that really stuck out for me is that we saw Asian Americans were less likely to have a sense of post-traumatic growth. I could not help but actually interpret that as sort of the ongoing discrimination, but one cannot be so sure. So that's just one example. But we're doing a little bit more digging with that construct. I've been talking with other people who are interested in that, with older adults as well. Sort of hard to know. I also don't know how predictive that is in terms of the overall outcome. And I'm still struggling to understand how that might be different from a general sense of resilience. So I think there's some operational issues that are at play.
Yeah, a related question, which I'll pose, but you don't have to answer because then I want to get to Vish's question, is just, regardless of looking at post-traumatic growth, it could also be interesting to look at the people who didn't report mental health problems, right? Whether or not they reported growth, if they just seemed like they were holding steady, if there are factors that predict not experiencing, given that so many people did experience mental health problems, like who are the people who didn't experience them? Are they coming from a particular place, or, do they report certain family characteristics? Like that could also be really interesting to look at.
Yeah. I know we have some students who are really interested in family connection or family connectedness. That's been sort of a funky measure, and we're sort of still struggling to figure out how best to use that. But given that so many students moved back home, or non-students, young adults moved back home, that is an area for exploration, is to understand like those relationships and whether or not that might account for how they see their future.
So Vish, you can unmute yourself.
Sure. Thank you. That was very nicely done, Cindy. Very, very helpful. Thank you. One question. You talked about impact on emotional health and other symptoms. I'm just curious if you also looked at any association with risky behaviors, say substance abuse or other kinds of risky behaviors.
Great. Yeah, and I think that there was another question here related to that as well from David Kelly. So we do have some measures of alcohol and drug use. And I don't recall the numbers off the top of my head, but the substance use numbers were actually quite low. So it was not something that was really usable data. My collaborator is looking at the alcohol data, and there was not any kind of apparent increase in the alcohol data. That being said, I don't really love the measures that we have, sort of these categorical measures that don't seem to be, that really don't fall into, we're still trying to understand like the distribution itself. But in general, I guess the long story is that we're still working on that, but there's no apparent increase in those outcomes.
Thank you.
Okay, anybody else have another question? If not, I'll pose another one I have. Here we've got one. Moving forward, what do you think are areas that we should be studying in young adults?
Yeah, so I actually am fascinated by the social climate, because I think that's just an area that people are missing when we think about, and it's not the pandemic, right? It's things that have coincided during the pandemic. So however you wish to think about it. but I think that these sort of like bigger issues are not necessarily being examined. I mean, I know Laura is interested in it. I know, others are interested in climate change, right? So it's not the pandemic per se, but these other sort of ongoing chronic issues, not really acute necessarily, hard to measure, which makes it super interesting for me because I'm like, oh, how do you measure something that is so unmeasurable? I think that's sort of the key to being able to decode and really support young adults. And I know that my response is probably very different from my clinical counterparts in psychiatry. My colleagues there are actually just day-to-day trying to ensure that their patients are not getting admitted, and that's what they're doing at the ground level. And know that, the pediatric ERs and all these other, ERs are just being flooded with these major acute needs. And so I don't necessarily think that the climate change and the feeling sense of safety is the answer to those particular issues that they're facing, these particular acute issues. But I think thinking more in terms of like the population level, that's perhaps the direction that I would want to go in.
Mm-hmm.
Just on that point, not to interrupt, there are some interesting data from Hong Kong where the social climate as a part of the larger struggle with the mainland government has been affecting people.
Yeah.
So it looks like there is a lot of interest now.
Yeah, that's a really good point. I mean, yes, I've been following that, and it kind of ebbs and flows, right, with respect to the activity that is involved in the protests that take place. We've seen that in the US, and I just like for that to be part of the discussion with mental health. I just don't see that being discussed.
Yeah, it's a great distinction. And actually, because I see there's another question in the chat about, well, what are the implications for mental health services provided on campus? And I'll ask you to answer that question, but I will also say I appreciated the distinction between what's happening acutely and what we need to do to kind of manage the acute problem, which is really, really, really serious.
Yeah.
But then the kind of bigger population health view, which is like, oh, we need to also be thinking about what are we doing so we don't have to have so much acute problems to be managing, right? And somehow we have to keep our eye on both of those.
Yeah.
But it's so easy to be just so distracted by this moment today. As you say, your colleagues are just trying to keep people out of the ER, which is critical. So anyway, I'll ask you to answer the question about mental health services on campus, and then we can come back to the question of, from a population health perspective, it would be really great if we could figure out how to not be in the place where we are now.
Yeah. I think that, both need to take place, right? So a sense of this existential crisis. I mean, I think if you are a provider, depending on the services that you do provide, that some acknowledgement of that in the context may matter, right? So you may have somebody who's presenting in your office with sort of suicidality, and it may be due to some sort of acute situation related to a relationship or to academics, to family. But at the same time, this is an individual who's participating in a lot of the, caring very much about social justice, right? And these other issues, or feeling compelled to be part of that, and maybe a pressure to, because that is just, they care so much about the world too. I do think that young adults are caring a great deal, and as a result, being burdened by it. How do you solve the world's problem? It's not one person. And even if you're, I hate to be pessimistic, but even if you join a protest, that's still not going to make a difference, right? And so it may generate that sense of hopelessness, and that coupled with any other proximal issues may lead to these acute distress. And so, if I'm not seeing patients right now, but that's something that I would acknowledge. It's just that context. And, for an individual, what is it that they can focus on in the moment rather than carrying the burdens of the world? It doesn't speak to the implications of mental health services. I feel like that is the service, setting up the services, the telehealth, I'm gonna defer that to, those are questions for my other colleagues. But I in terms of like risk factors, sources of stress, I do think that acknowledgement of that from a provider standpoint can be a way to open up conversations. Yeah.
Great. So I have 2 more questions that I'll pose, and other folks are welcome to also jump in. But one is, if you think that part of what might be, is there some developmental issue that is why youth in particular are struggling, with the pandemic more than some of the other age groups? And the other question is one that the center has been really interested in, is thinking about the role of social media. And we've been talking about social media as potentially both a good or a bad, depending on kind of how it's used and so forth. So I wonder if you could share any thoughts on those 2 issues.
Yeah. All right. Well, I'll share my opinion, data driven or not. I think social media plays a big role. And the way that I think about it, I think it's more problematic, though not dismissing its sort of positive features. I think for young people, social media is essentially this ongoing exposure to stresses. And if you think, and I'm such a concrete thinker, if you hold up your phone and you are scrolling, you're essentially exposing yourself to a wide range of opinions and images, it just happens so rapidly that it's difficult to process. And that's not something we've really seen in previous generations. Now, certainly, we've had TV and other technologies, but I think social media is somewhat different because it is an exposure to so many opinions and people and impressions. And when that takes place during these formative years in which you are developing a sense of identity, a sense of your self-image and self-esteem, you can imagine then that those exposures are basically pulling an individual away from perhaps the expected or the hoped for trajectory in one's formation of their of a positive identity. And if you think about it from that sort of developmental psychopathology standpoint, they're being derailed. And what's bringing them back to sort of that, again, more positive trajectory. And I'm not sure if there is anything that's bringing them back, right? So we have social media, but we don't have sort of a set of buffers that basically allow them to do that safely, that allows the promotion of their development. So I do think that from that conceptual standpoint, I do think that social media plays a huge role. And there's now evidence that shows, various exposures. It's not experimental, right? It's difficult to look at that experimentally, but I think there's a good amount of evidence to show that those images and that take place among adolescents make a difference.
Yeah, I guess it's tricky too, because it's easy to confuse social media with all the other things you can do with internet, or I don't know what you call it, like right. Connectivity, right? Because of course right. Zoom has allowed people to be connected, and that seems like a positive thing.
Right. Right. Absolutely. I think it's not to say that your self-image is not impacted by television. And this is where, I always look to my colleagues who study social media. She always says, people are really fascinated by different platforms. That's the first question they ask, is like, well, where you're thinking about social media, don't you have to think about these different platforms? And for her, she doesn't necessarily think about these different platforms so much, that distinction is not as important to her as how young adults or adolescents engage with it. So that process of engagement is far outweighs the actual platform that they're using.
Mm-hmm.
That is interesting. As someone who studies social media, that one would approach it platform agnostically. I think that's certainly fascinating to me. So, anybody paying close attention to social media will immediately realize the different functions they serve. There's been enough specialization now, as opposed to 5, 10, 15 years ago when social media meant two things or one thing.
Yeah.
But today, social media means so many different things, from blogs to YouTube to vlogs to WhatsApp or others. So it's a little. I'm somewhat skeptical of that approach. That one should be platform agnostic.
Yeah.
Given what we know and what we don't know actually about the data. So.
Yeah. Thank you. Yeah, that's really helpful because that's sort of what I lean towards too. It's like, well, are you talking about Twitter or are you talking about YouTube? But yeah, my colleague seems to think it's really about, and she's also a qualitative researcher too. So it's interesting, like, like you, she really likes to sort of think about how they talk about it, what they're getting from it, like what adolescents are saying. Yeah.
The other issue to also remember is different social media have different profiles in terms of platforms of users.
Yeah.
Twitter is a completely different set of users compared to LinkedIn, to WhatsApp, to Facebook.
Yeah, exactly.
So just so we can end on a slightly higher note, if you had just one or two things you would tell people in terms of promoting resilience and recovery, or ability to do okay coming out of this, has the research pointed you in any direction?
That's a really good question. The important one. Well, I can tell you what I am inspired by. So let's maybe I can start with that. So I think I'm inspired by some of the infographics that I showed towards the end, which is that for whatever reason, despite the findings that are downers, that young people are still saying that it's sort of worth it to stand up for their, for their vision. And in many ways, they are exhibiting hope. So it's weird that they are not saying they are growing from the experience. And while we don't have a measure of hopefulness, the qualitative research and just their engagement suggests that they are. Like those actions themselves exemplify a sense of hope. So it makes me think that maybe I should try to include a hopeful measure. But so that's what I've been learning so far. And the question is, well, why? Why, if everything is sort of, if you have such high rates of mental health problems and you're saying you're not growing from the experience, then why would you still get together with others and, stand up for social justice? So that's, to me, that's so intriguing, right? Why? Like, and I'm such a, practical person, and you're like, well, just give up. Like, maybe it doesn't make a difference, right? But no, that the responses are not at all related to giving up. And so, so I'm hoping to get to the bottom of that somehow. And I'm also hoping to, as I mentioned, that it doesn't sort of lead to this feeling of being burdened. I think it's such a double-edged sword to try to stand up for justice, but not be burdened by it. And we started to sort of dabble in understanding whether or not those who are much more socially conscious, or we have a critical consciousness measure, actually. We haven't really looked too closely at the data, but we've sort of dabbled with it to understand whether or not if you score high in critical consciousness, are you actually more apt to experience trauma, right? Because we know and we hear from people who are advocates that it's like hard work. And many of my colleagues have ended up, going to therapy for the first time during this past year after doing a lot of advocacy. So we'd like to look more quantitatively at that. But yeah, I think that there is a sense of hope that is really inspiring, and it makes me want to actually continue with this work. So it's a really good question. Thanks for asking it.
All right. Well, thank you so much. Thanks to everybody who joined us. Just really quickly, this was our last seminar for 2021. We pick up again in 2022 on January 26th with actually Dr. Vish Viswanath, who is going to be giving his talk. I don't have the title of the talk here, so Vish, what are you speaking about in 2022? Do we have a title yet?
We don't have a title yet, but we will be talking about our data from the cohort we are developing of teenagers around issues of resilience, media, exposure.
An excellent follow-on talk to this one. So I hope everyone will join us for that. And in the meantime, Malia is going to put a RSVP or link for that in the chat. And in the meantime, I hope everyone has, you know, a warm and safe and healthy holiday season with a chance for rest and restoration and some joy as well. So thanks all for coming, and thank you, Cindy, so much for sharing your work, and we'll look forward to hearing more. We'll bring you back so we can get the next installment.
Thank you so much. Happy holidays, everyone.
Thanks, Cindy.
Bye.